Today is the first day after your surgery. You may be wondering about all the different medical machines and devices in your hospital room. Let's take a minute to learn what each of these is for. It is common to have oxygen distributed into your nose by a tube to help you breathe more easily. This oxygen tube is only temporary. You will most likely have it removed after the first day or so. You may be wearing inflatable foot or leg pumps that inflate and deflate throughout the day. These help with blood circulation. Your doctor may also want you to wear long white stockings called TED hose. These also help with blood circulation. You will also notice a soft, flexible needle has been inserted into a vein in your arm or at the top of your hand. This is called an IV, and it will help you receive fluid and medicine into your body. The medicine and fluid are held in the plastic bag hanging by your bed. The medicine flows from the bag down the plastic tube connected to the needle and into your arm or the top of your hand. A nurse will check the IV and change the medicine in the IV bag several times throughout the day. This is important because proper medication and hydration are a big part of helping you heal and keeping you comfortable. It is normal to experience some discomfort after surgery, but it is important that your pain is well controlled. For your convenience, you have a button called a PCA next to your bed. This stands for Patient Controlled Analgesia. When you feel you need pain medicine, you will push the PCA button. Your nurse will show you how to use this. We may also apply ice to the wounds many times throughout the day. This will help keep swelling down and decrease your pain. We want to make sure you are comfortable, so if the PCA is not controlling your pain, make sure to let your nurse know. Your nurse will also show you how to use a piece of equipment that helps exercise your lungs and keeps them working well after surgery. This is called an incentive spirometer. It is important to use throughout the day. Nurses and hospital staff are here to help you during your stay. A call button has been placed next to your bed to use when you need assistance or have questions. The hospital staff will show you how to use this button. It is important to make sure this is near you at all times. Many patients find it difficult to get out of bed and walk to the bathroom for a few days after their surgery. This is why you may have a urinary catheter. This device will help you urinate without having to leave your bed. You may also notice another tube has been inserted into your wound. This is called a wound drain. It is used to collect excess fluid from your new hip, which helps the healing process. While you're healing, it is very important that you avoid crossing your legs, because doing so may dislocate your new hip. A foam wedge or pillow may be placed between your legs to prevent crossing. It is very important to keep this wedge or pillow in place at all times. Finally, you will notice a message board in your room. This will be updated every day so you know the name of the nurse on duty and other important information. The nurse will point this message board out to you. Most patients have some questions about how this all works. Take a moment to write down any questions you may have or topics you would like to discuss with the hospital staff. Always remember, we are here to help. Now let's go over what will be happening today. You will have 3 different nurses taking care of you during each 24-hour period. The nurses change shift in the early morning, at mid-afternoon, and in the late evening. When nurses change shifts, they may stand by your bed to discuss your care and share information. This is done to make sure your care is consistent throughout the day. Your nurse will come back in to check on you throughout the day. Your nurse will ask you about your pain levels and may hold up a sign with faces demonstrating different amounts of pain. Remember, controlling your pain is very important. Always be sure to let the nurse know if you are in pain. Anytime you are given medication, have your blood drawn, or have a test taken, the hospital staff member will ask your name, check and scan your wristband, and scan your medication. This is done to make sure each patient receives the right medication and treatment. After surgery, many patients receive medication to decrease their risk of developing blood clots. This medication will be given either as a shot or a pill. If you receive a shot, it is typically given in your stomach. The nurse will let you know about this. Each day, the nurses will check the skin on your arms and legs and will turn you on your side to check your skin on your back. This daily check is to make sure you don't develop uncomfortable problems from lying in bed. A nursing assistant will come in to help bathe you each day. They will usually bring in a basin of water and will help you clean your upper and lower body. The nursing assistant will also change your hospital gown, make your bed, and help with any other hygienic or housekeeping items you may need assistance with. Physical therapy is an extremely important part of your post-surgery rehabilitation. We have 3 goals for your first day of physical therapy. The first is to help you understand the precautions you need to take with your new hip. The second is to help you get out of bed and walk a little with your walker. Third is to sit in the chair by your bed for a little while. Your physical therapist will also begin helping with the exercises that will be part of your daily routine throughout the healing process. We know that today is your first day of recovery, and you may not feel very good, but it is important you are patient with yourself and do the best you can. First, your physical therapist will go over your hip precautions, showing you the ways you should not move your leg while your hip heals. The therapist will discuss each of these 3 precautions with you in detail. Do not cross your legs. Do not bend forward at the waist or move your leg up past 90 degrees. Do not turn your foot in or out excessively. Your therapist will talk to you about all of this in detail, but here is a little bit about what you should expect on your first day of therapy. Getting out of bed for the first time is difficult, especially because of your new hip precautions. Your hospital bed is soft and your gown is difficult to move around in. Don't worry, your therapist will show you the best way to get out of bed. It is very important to let your therapist know if you are not feeling well when you sit up for the first time. It is normal to feel a little dizzy when you first sit up, but that should go away after a few minutes. After you have sat up for the first time, you may have to sit on the side of your bed for a few minutes while you wait for the dizziness to pass. If you are feeling okay, the next step will be to try to stand up with a walker with the help of your physical therapist. If you do okay standing, the therapist will show you how to walk a few steps with the walker. It is important to follow the hip precautions when you sit down in the chair by putting your operated leg forward. Your therapist will show you how to do this. Once you are sitting, your therapist will make sure the nurse call button is by you so you can let the hospital staff know when you are ready to go back to bed. This is a good time to use the incentive spirometer we talked about. Remember, this helps you exercise your lungs. In addition to nurses and your physical therapist, your doctor-patient care coordinator and dietitian may also come by to see you today. Your doctor or the doctor's assistant will check on you and your wound each day and may remove the drain from your wound if you have one. The patient care coordinator is another nurse who will talk to you about what you need after you leave the hospital. For example, your patient care coordinator may ask you who will be taking care of you, will discuss equipment that you may need, and how many stairs you have in your house. All of these questions will help prepare you for leaving the hospital. Your dietitian will visit each day to ask you what you would like to eat the following day. A volunteer may also come by to check on you and give you a newspaper. A house cleaner might come in and out to clean your room and your bathroom. This first day after surgery is a very important one. A lot of people will be taking care of you. To help them do this, be sure to let them know what you need and how you are feeling. They are here to help and make you as comfortable as possible. Even though you will probably experience some discomfort, try your best with physical therapy. It will help you feel better more quickly. Remember to let your nurse know if you are in pain. Most patients start feeling better as the day goes on.